Here we learn about the multiple endocrine neoplasia. It's the MEN syndrome. Here is the combination of the multiple adenoma and the hyperplasia of the different endocrine organs, which are the group of the genetic disorder produces the heterogeneous clinical features. There is the classification of the MEN is classified into MEN type 1, MEN type 2 and the mix 1. The MEN type 1 is also called the Werner syndrome, whereas the MEN type 2 is also called the Sippel syndrome. MEN type 1, it is the adenoma of the parathyroid, pancreatic islets and the pituitary. The most common hyperplasia and the adenoma occurs in the parathyroid, that is the hyperparathyroidism. It is the most common, that is clinical manifestation. Pancreatic islets of the cells, it's a hyperplasia and adenoma seen in the 80%. With the Zollinger-Ellison syndromes. Now the MEN type 2, it is Sippel syndrome. It is the combination of medullary carcinoma and pheochromocytoma. The further divided into MEN type 2A and MEN type 2B. In the MEN type 2A, it is contain a familial medullary carcinoma of the thyroid, cutaneous lichen amyloidosis, Hirschsprung's disease. And in the MEN type 2B, it is the combination of medullary carcinoma of the thyroid, pheochromocytoma, mucosal neuroma and intestinal ganglioneuromatosis. And the mix, here the last one is a mixed syndrome. It is including a variety of endocrine neoplastic combination which are distinct from the MEN type 1 and MEN type 2. Here some example in this contain, that is von Hippel's Lindau syndrome and the type 1 neurofibromatosis.